It's Wake Up Wyoming Special Town Hall. My name is Glenn Woods. Our news director, Nick, is sitting across from me. Now, Nick, this is one of those we had a discussion for quite a while in this program one day about the proper pronunciation of different places around the state of Wyoming. Mm-hmm. So Kim Profit is from what county?
Uinta County.
Uinta? Okay. Kim, how do you pronounce it?
Same way, Uinta.
Okay, because I've heard Unita as well, which I know is completely wrong.
That's a transposition of the N and the I.
That
right?
is, yeah. So, okay, you got to be very careful about that. Okay, so since we've been talking about energy, and of course, Wyoming's economy has come to almost a screeching halt because of the energy industry and COVID-19. But here we are, what seems to be, we would hope, in a recovery phase. But then again, I've got to ask you, you're the nurse manager for the county there in your county. I'm not even going to try to pronounce it anymore.
Uinta.
Sure it is. So how is it going there? Are we seeing an upsurge? Is it starting to get busy again? Or are you going to have to worry about the economy coming to another screeching halt with another resurgence of this?
We've had a pretty busy couple of weeks here down in our little corner of the state, which definitely has impacted everything. And it's really, I think it's served as an illustration of what we've been talking about all along, that if businesses and if companies don't take things seriously, that it could impact them, not because of any order, but simply because of illness and because of people not wanting to go there, because of an outbreak.
Well, and that's something we've talked about, Glenn, with these reopenings. I mean, it's not just are the restrictions lifted, it's do people feel safe to go out and be around other folks? Do you want to go to a restaurant? I mean, there's a couple restaurants around town that I really like. Yeah. Having worked in restaurants, I have a little bit of a question about cleanliness in some of those places, and so knowing that there's a virus going around, do I trust that?
But the restaurants
joint?
we love the most are usually the least cleanly. But here's the thing that gets me.
That's true. Yeah.
When the waitress walks up to me wearing a mask, but in order for me to hear her, she lifts the mask. I've seen that a couple of times.
Yeah.
So,
so Ms. Profit, I wanted to ask you, maybe you can detail for us what's been going on in Uinta County the last couple of weeks. I mean, you guys went very quickly from having not a ton of cases, as I understood it, to I think being second or third highest total just in confirmed cases in the state.
Yeah, that's correct. Back on June 4th, we had a total of 10 from the beginning of the virus in the state. We had just kind of slowly gathered up to 10, and then in a period of two and 3 weeks, we have increased by 12 times 12. So we went from 10, and now we're actually at about 130 as of this morning. Our
Wow.
new cases this morning.
And last week it was just 80, wasn't it?
Well, last week it was 98, and the week before that it was 48.
Jeez. And so what contributes to that huge spike? I mean, Dr. Mark Dowell, who's Natrona County Health Officer, he was on with us earlier this morning, and he talked about young people gathering and not wearing masks and not social distancing. Is that what you're seeing in Uinta County as well?
It is. As we started doing our interviewing and contact tracing, there started to be some lines drawn to Memorial Day weekend, and specifically some parties and some bar gatherings.
And so, I guess going forward, I mean, what do folks in Uinta County and really everywhere? Because if it's a phenomenon there, there's no reason it wouldn't be happening here to the same extent, right? Unless it's a particular local event. But it sounds like that's not what you're describing as being the source for this uptick. So, what's your messaging to your neighbors in Uinta County about slowing the spread and avoiding this spiking further?
We've talked a lot about personal responsibility, and I think that's kind of a common theme that's been going on since the beginning of this. But, your actions do matter, and your actions also can affect others, not just yourself. So that's been one part of the messaging. And then secondly, we've just really been trying to support and encourage and reiterate to our businesses the importance of adhering to the guidelines. And I think we have served as an illustration that the guidelines do matter, and they do make a difference.
Something I've seen questioned on social media, is whether traffic from Utah has anything to do with this. You guys kind of sit right there on I-80 going over into the next state. So does that traffic have anything to do with the recent spike there?
We are very close to Utah, and we kind of see them as our backyard and our shopping place. And they come through here to go up to our mountains, the Uinta Mountains. And so I know a lot of people have asked that, and I think, we don't know exactly where maybe case 0 came from. We don't know where the index case came from. It's likely that it came from out of state, but I mean, that doesn't seem to be the question. The question more is, as we looked at our residents, they were gathered at that bar, a lot of them at those bars, and And so if the virus did come from out of state, we did our own job of spreading it around.
Sure, I can understand that. It just seems like here there have been, and this is just anecdotal, right? I don't have a statistic on this, but Glenn, maybe you can back me up. If I have to make a Walmart run or go over to Albertsons to get something for stir fry, I'm seeing fewer people, it feels like, wearing masks. Is that a trend in Uinta County?
Well,
and if so, what's contributing to that?
Let me toss that in real quick. Again, we say wearing masks, but also wiping your hands down, using
Staying
the
6 feet
sanitizer,
away,
wiping
right.
the cart down,
one-way
things
aisles,
like that.
all those things. Yeah.
Right. I think because of our spike here, we've actually seen a little bit of a correction of that trend where, we've been talking a lot about like this is the time for caution. We really want to get this thing slowed down. I mean, we had an increase of 50 cases in 1 week, and so I think because of that, we've seen people step up a little and go back to the masks, take a little more caution, and I do feel like maybe we're starting to see a little bit of a taper.
That's good news. And the neighbors there, your neighbors in Uinta County who have contracted COVID-19 in the last couple of weeks, are there any of those cases that are particularly serious? I guess, do you know off the top of your head how many of those people are hospitalized?
We have 3 currently hospitalized. We've had 5 that were, and now we're to 3 that are currently hospitalized.
Okay, and I hope the outlook for those folks is good. I don't know if you have that information or not.
I don't have current updates on their status, but I'm with you. I do hope that things go well for them.
And in terms of, we've talked earlier today about ICU beds and their availability kind of across the country or in different areas. But in terms of your local healthcare capacity to respond to this new uptick in COVID-19 cases in Uinta County, what's that like? Do you have the resources that you need? Are there enough ICU beds, that kind of thing?
That's definitely been our concern from the start, and we've been working very closely with our local hospital. They have 6 ICU beds currently, 3 that they've kind of cordoned off that those are specific to COVID, and 3 non. And, that's not a lot. And for a community, when we have this many cases per capita in our community, it's a little worrisome. But I have to say, so far, we're doing all right. The thing that strained most our capacity is simply keeping up with the number of tests we need to do and then the contact tracing.
And so what advice do you have? I mean, obviously, we're broadcasting in a lot of places that aren't Uinta County this morning, but based on what you've seen there, do you have some advice for the rest of the state as far as avoiding the spike that you all just saw?
Yeah, I think, and it's nothing new and it's nothing special, but maintaining the social distancing, the mask wearing, research continues to show us that the mask wearing does make a difference. And so I think those are kind of the keys, and that, this is real. It was easy to be insulated in Wyoming, I think, and to feel a little like it wasn't really going to come here. And, that's not the case. And I had a moment of some frantic, feelings over the last couple of weeks where I thought we might not get a hold of this. We might not get this turned around. And, there are enough folks in our community that fall into those high-risk categories that it was very concerning. Luckily, I do feel like our community pulled together. I have some good contact tracers that have worked very hard, and I think maybe we're starting to get a handle on it.
And I wanted to ask you, too, real quick, a point of clarification for folks who may be unclear on it. The masks are not designed to keep you or I from getting the disease. They're designed to, if you or I have it and are spreading it without showing symptoms, knowing that we should stay at home or go to a doctor, the mask is designed to keep those droplets or that respiratory stuff from getting to other folks and spreading it to them.
That's exactly how I understand it as well. That, we're doing it for our community, not necessarily for ourselves.
I think that's a good way to look at it. Thank you very much for your time.
Real quick lightning round here. So how do you say Wapiti, or how do you pronounce that again?
Wapiti, Glenn.
Yes. Kim?
Wapiti.
Okay. Just making sure. You have Vita Vu is another tough one here, as long as we're on some tough names over there. And let's see. There was Matitsi.
Yeah, Matitsi. Proposia is a toughie, too.
Yeah,
I will say that, I started in Laramie in this business almost 5 years ago, and the first time I tried to say Togedy on air, I got a couple of phone calls.
Yeah, you got a couple of phone calls with it. Kim, thanks for coming on. I appreciate it.